This is Dr. Best, your friendly neighborhood cardiologist. Today I want to talk to you about a very serious situation, sudden cardiac arrest. The heart is an amazing organ. It has its own electrical system. It has its own way to supply blood to itself. And from a structural standpoint, it is probably one of the most unique organs in the body. Unfortunately, there are times when the heart does things that we don't expect or have issues with. One of those things is sudden cardiac arrest. Sudden cardiac arrest is when the heart stops suddenly, typically due to an electrical problem with the heart. Now, there can be a host of other reasons why that electrical problem has occurred, everything ranging from congenital, things you're born with, or hereditary, exposures, various things like that can cause it. Now, this doesn't only happen in older individuals. It can happen in the young. And that's why it's so important to understand risk factors and how to approach it when an individual has sudden cardiac arrest. Sudden cardiac arrest in the young is typically caused by some congenital abnormality, meaning something they're born with, or a genetic cause that's hereditary. Remember, sudden cardiac arrest is different than a heart attack. Heart attack requires heart artery blockage due to calcium and other things such as that. But sudden cardiac arrest, again, understand, is an electrical problem, a problem with the electrical system. Now, I know you're wondering, I don't want that to happen. It's scary, it's troubling. But prevention is key. One of the key things you can do is make sure that you monitor your symptoms. If you're an athlete, as you can see, I'm on the track about to get some training in. But if you're an athlete, if you have a problem, say something. Make sure you're getting your checkups, whether it's a heart screening checkup or just visiting your primary care provider. The final thing is to make sure you're asking questions to your family, to your friends, and making sure that things are okay. At the end of the day, prevention is key. Making sure that if you have those issues or you have problems, you say something. Additionally, you need to be one of those individuals that can act in the event of sudden cardiac arrest. So what do you do if something happens? If you see something, say something, but remember, starting that emergency response process is key. If you're training, make sure you know where your AED is. If you are an athlete or a coach, make sure you understand and have a familiarity with CPR. There's a program that we do, my team and I do, called ECA, or Everyone Can Assist, which focuses on emergency response, CPR, and AED. We've piloted this program at high schools, football clinics, camps, you name it, just to make sure people are aware of the risk and can understand and know how to respond to sudden cardiac arrest events. Understand, sudden cardiac arrest is not a common phenomenon, occurring in about 1 in 5,000 to upwards of 1 in 10 or 20,000 individuals. But when it happens, it can be devastating. So make sure that you're ready to respond in the event that sudden cardiac arrest occurs. Remember, knowledge is power. Whether it's a TikTok video, an Instagram reel, or just reading things on the internet, making sure that you're aware of the risk factors, ways to prevent, and ways that you can help during sudden cardiac arrest are going to be vitally important. In an effort to increase awareness about sudden cardiac arrest, I've partnered with some major folks and other organizations that are focused on keeping you healthy. If you want more information, please let me know. Just a comment in the chat. In any case, get back to training. Prevention is key and knowledge is power.